Hello everyone. In this video presentation I will share to cover the legal, professional, and ethical frameworks of prescribing, including considerations like accountability, consent, negligence, liability, and record keeping. This video aims and objectives focuses on the following key factors. 1. The purpose is to ensure prescribers understand the legal, professional, and ethical frameworks that underpin their practice, and focus on areas like the legal frameworks enabling non-medical prescribing, the understanding risks like consent violations, negligence, and liability, and ethical frameworks guiding decision-making and patient safety. Now, hearing the context of modern healthcare, it highlights those challenges in healthcare, those limited resources, the increasing demand with finite healthcare budgets, the blurring boundaries, the expansion of non-medical roles to address gaps. Patient empowerment. Patients are now more informed and influenced by the public and media, often consulting online resources, e.g., Dr. Google. Litigation risks and trends. Growing culture of complaints and legal claims. Now what extended roles? Questions to ask or ask yourself. Do prescribers should critically assess and evaluate the legal authority? Does the law allow this action? The permission. Is this task sanctioned within the workplace or profession? Your competence. Am I trained and skilled enough to perform this action and tasks within my scope of practice? Listening to this, the ability to prescribe medication comes with an increased risk of causing harm to patients, for which the healthcare practitioner is accountable. This highlights the need for prescribers to take personal responsibility for their decisions by working within a firm scope of practice and to adhering the limit of their competence, to protect both their professional integrity and the public. Now, what do you think is a benefit of non-medical prescribing? Also considering the costs and the risks. Let us talk about and find out the benefits of non-medical prescribing. Benefits of non-medical prescribing are: improved patient care, without compromising a patient's safety, make it easier for patients to get the medicines they need, increase patient choice in accessing medicines, make better use of the skills of health professionals, contribute to the introduction of more flexible team working across the NHS. To mention it again. To improve patient care. Reduces delays in accessing medications. Empowers patients with more choice and flexibility. Enhances teamwork in healthcare settings by utilizing diverse professional skills. Can you think of any dilemmas you may face in prescribing? Or what do you think are those challenges you may face ahead in prescribing? Those dilemmas or challenges in prescribing includes non-concordance or non-adherence. Patients may not take prescribed medicines, leading to waste and poor outcomes. Commercial pressures. Push from pharmaceutical companies, generic versus brand prescriptions or cost considerations. Covert medication. Ethical dilemmas arise when disguising medication in food drinks, particularly without patient consent. And patient-professional conflicts, balancing patient choice against clinical judgment. It can be the NICE guidelines or local prescribing protocols. How about dilemmas in the scope of aesthetics? If you do not hold a prescribing qualification yourself, but you wish to perform Botox treatments, you will need to work with a prescriber. Prior to treatment, every single one of your Botox patients must see your prescriber in person and undergo a medical consultation. This allows the prescriber to verify that the patient is safe to have treatment and that they are happy to prescribe the medication for them. For many years, it was fairly common for prescribers to remote prescribe. This meant that they didn't meet the patients in person, but instead spoke to them briefly on the phone or via Skype, before signing off a prescription for them. Remote prescribing of Botox is now banned under the NMC, GMC, and GDC and absolutely should not be considered as an alternative to a face-to-face consultation. Let's hear about non-concordance or non-adherence. It is thought that between a third and a half of all medicines prescribed for long-term conditions are not taken as recommended. If the prescription is appropriate, then this may represent a loss to patients, the healthcare system and society. The costs are both personal and economic. This is why shared decision-making is important. Hope you enjoy it and thanks for watching. See you to the continuation and part 2 of this video.